Good morning, and thank you for joining us today to learn more about how Strategic Health Services can customize your wellness solution for stronger engagement and better outcomes. My name is Susan Plumer. I'm the Vice President of Healthcare Sales for Strategic Health Services, and today you will learn how technology, coaching, reporting, and highly customized communications is a winning combination for your employee wellness. And as a reminder to honor Breast Cancer Awareness Month, for those of you who are on the webinar today and that do decide that SHS is the right solution for your employees, we will include spouses for no charge for the term of your contract. And why we've chosen to do this is because we believe so strongly in having the support of one's family when going through a health transformation, whether it be just losing 5 pounds or having to deal with a more chronic disease like breast cancer. So today, I'm going to talk about our wellness solution for employees and talk briefly about how hospitals can use that solution to sell to employers in their community. So really, as you can see here, the SHS Strategy, we really have a two-pronged approach to wellness. First, we sell to hospitals as employers, providing a comprehensive solution for your own employees. Then, we private label that solution for you, and you may even call it a different name for you to go out to the community. And we help package that with your other hospital services. We help market and sell it to employers in your community, as well as the community at large, such as maybe church groups or more of an indigent population. And we can also use it if a hospital has become what we call a payvider, a provider health-sponsored health plan that needs a wellness solution. So we can incorporate that for you as well. We want your hospital to be seen as the hub of wellness in your community. So we don't want you to be seen just as a place to go when you are sick, but when you are well too. And so really SHS is the engine underneath your wellness program and your services. And as you can see from this picture, we're kind of like the roots that are underneath the growing hospital services. And so by using the tools that we have, we believe that you can help grow your services in your community to ultimately bring new revenue to your hospital. So it's very important that you start with your own employees. So when you go out and talk with your employers, you have that proof data and your story becomes more compelling. So because you want to start with your own employees, we're going to talk to you about our own solution and how easy it is to get started, and even show you some of the data and reporting that you'll be able to share with other employers as part of your proof concept. So here comes the Strategic Health Services Wellness Solution, how the program works, the process, and the timeline. So our rule for success number one is always knowing that what works for one person probably won't work for anyone else, right? So when you're talking about a wellness program, it really can't be a one-size-fits-all. There really does need to be some type of customization. So for the person that has lost weight on a specific diet, that specific diet isn't going to work for everyone. For that person who has gotten up every morning at 5 o'clock and exercised, that's not going to work for the person who is a single mom and has 3 kids at home and has to get them all ready for school. So it is a personalized journey that everyone takes. And what we've learned from working with many customers and their employees is that there always is that aha moment. You know, whether it be an obese person trying to get on a ride at Disney World and they couldn't fit on the ride and their 11-year-old was crying, or whether it was going to the doctor and their doctor saying, okay, now it's gotten kind of serious. So we know that there isn't a one-size-fits-all, and our solution is really customizable, and we work with individuals, we work with job types. We really try to help each individual understand their barrier to health and support them. So why is everyone focused on wellness today, aside from the fact that the ACA mandates that companies use some kind of a wellness program? And we know that unhealthy behaviors equals high medical claims. But, you know, we really have a huge problem in our country today, especially as it relates to diabetes and obesity. And so aside, and you can see right in front of you, you know, the increased medical costs that this bears on employers, an unhealthy population is just unproductive. They are absent more often, and just generally an unhappy population. So what we have learned through our research is that really the inability for people to make a change really comes from lack of awareness. So a lot of people that are in all kinds of different jobs, and there are many hospitals today on this webinar, even people that work in hospitals don't understand their health. They don't understand their biometric screening results. They don't know what high HDL or high LDL means, or that having, you know, high blood pressure could lead to a stroke. And so here you can see, just as it relates to diabetes here, I mean, 12% of all adults have it, 28% don't know, 37% are pre-diabetic. 89% of those are unaware, and that's where we are really needing to target the pre-zones, and I'm going to talk about that in a little bit. And again, hypertension, 39% of adults have it, 53% are unaware. And guess what? Everyone wants to be healthy. This is a statistic taken from an MBA PhD that says 88% of Americans would rather be healthy than rich, and that we know that only 37% expect to be in good health in a decade. So we really need, we know people want it, we know they're motivated, and really the people that are most motivated, that we realize, are the people in these pre-zone conditions. Because a lot of times, once those individuals go over to that highly chronic and their full-blown diabetes, or their BMI is, you know, above 35, they're not as motivated as these people that fall into these pre-zones. And as you can see, I mean, there's certainly a cost that, I mean, from a medical expense standpoint, it's worth focusing on these pre-zones, but from a motivation standpoint, we know that these folks are in a zone where they want to, once they're aware, they want to make a change. So our program is really focused on these pre-existing or pre-emerging conditions. You know, once our program stratifies the population into 5 categories, 1 being the healthiest, 5 being the most chronic, and those 1 through 3s are really the biggest target that we work with and that our coaches work with today. So here is how our technology supports our clients. It is a robust, highly interactive portal that provides many opportunities for engagement based on personal goals, needs, and habits of your employees. Let me take you through a few things here that I think are very important as it relates to engagement and a differentiation in our portal. So My Pathway to Health is our portal. This, again, is all private labeled for you. Some of the things that are important in engaging your population is you need to be able to integrate with consumer devices and applications. We integrate with over 125. We want to make sure that if people are already doing that they don't have to make a change, so that it's real time, anywhere, anytime. That information that gets from a Fitbit, from a Garmin, from anything, Map My Fitness, all of the steps, calories, food that they're eating, if they're tracking that, can go right into the portal. Secondly, we hear a lot about making a wellness program fun. So we know that, they have to take the HRA, they need to do the biometric screening, but how do we make it more fun? And fun equals engagement. So we have 2 parts of our program that are fun. One, that make it more fun, I should say. So we have something that's called UtiliFit, which is sedentary disruption activities, and that is where members can sign up for a game a day. There's over 400 games to choose from that give them different activities to do throughout the day. So for those people that are sitting at desks, and we know that sitting is the new smoking, this gives them some kind of an initiative to get up from their desk every once an hour. And it is really based on the physical capabilities of the person. So if you are a fitness fanatic, you might sign up for Beachbody and be doing push-ups and lunges. But other people may have some physical barriers, and they may just stand up and raise their leg 10 times. But whatever it is, it's getting your people to get up and move around, and seeing the person next to you doing the same thing at the same time does create some camaraderie. And the second piece of the health entertainment that we offer is step challenges. And these step challenges are important when you're trying to build camaraderie amongst your company. So these are built, you can work with teams, there's team captains, there's a lead generation board, so there is a social aspect to this challenge. These are 6-week challenges where you're being chased by aliens or zombies, and people, it does create a lot of fun. We recommend that employers roll this out, you know, right after an open enrollment or right after your HRA and biometric screenings have been taken, so that they can start to have some fun with the program. Clinical device integration also, we can work with glucose monitors or blood pressure cuffs if you're wanting to capture that data. We have a personal health record where if you are self-funded, which many of you on this call will be, that claims data can go right into this personal health record, updating your doctor's appointments, your medications, your allergies. So all of this can be housed in one place. So if you are going to see a physician, you don't need to bring an empty bag of prescription drugs. You can just print out this piece of paper. Again, for the folks on here, again, that are self-funded, we do take claims data into our system, which we can also do from an ROI perspective, predictive modeling and forecasting. This also gives us information on gaps in care, medical and pharmacies, so that our coaches can do better targeted interventions for those individuals. So I'd like to talk to you a little bit about incentives. We track incentives on our portal, but we also can help you design incentives. And before we get started with anyone's program, we like to survey your employees and see what's important to them and see what might motivate them in participating with a program. So, for example, we know that the ability to give back is important to a lot of people. So even though you might want a $25 gift card, the ability to maybe give to a favorite charity motivates people more than you would think. So even someone making $10 an hour wants the ability to be able to give back. And since we are in October and Breast Cancer Awareness Month, some of our clients have chosen, and which are hospitals, for every employee that takes a mammogram, they're donating a mammogram to someone in the community who doesn't have health insurance. And that has really, really resonated with a lot of folks and driven engagement up. And some of the hospitals have even tracked people's lives that they have saved. So who doesn't want to save someone's life? So putting together incentive packages that really are meaningful will help drive your engagement. For those of you, again, who are hospitals, we have the ability to push information out to EMRs. Of course, we want to decide what's clinically relevant so that we don't clutter up that physician's database. This is an example of what the portal looks like. And this is one of our customers in Ashland, Kentucky, King's Daughters Medical Center. So as you can see here on the right-hand side, this is their portal that they have rolled out for their own employees. And then they are also a reseller. So they have packaged up this wellness program. They have packaged it with some other solutions like telemedicine, remote monitoring, occupational medicine, and they have called it My Health Solutions. And that private label sits on their portal as they go out and work with employers in their community. So now let's talk about health coaching. Support is essential. It's essential for anyone. If we look around the world that we live in, coaching creates not only support, but it creates accountability. So your athletes are using coaches. Your executives are using coaches. Your children, if they're in school, they might have a tutor. Those are considered coaches. So we know that we all need support, and we need support even when we're making a journey to improve our health. And when we're talking about coaching and you're looking at wellness programs, don't look at a passive coaching program. You need targeted outreaches. You don't want people wait. You can't say, oh, you have unlimited inbound coaching and waiting for those people to make a call, because they won't. You want to have a program that has coaches that are going to be working with these individuals. They are going to be making outreach calls to educate them, to create awareness, to do goal setting with them. Our program and our process is set up so that when your HRA and your biometric screening are taken, your results are created into a personal health profile. This is a 27-page personalized health profile customized for each individual that aggregates all their results and gives them recommendations for health improvement. This is a trigger for our coaches to start making outreach calls to those individuals. So they, like I said before, many people are not aware what all of these results mean. So they're calling to go over what the risk scores mean, what the gaps in care identified in here means, and go over those biometric screenings. It's also an opportunity for them to start their goal setting tools and goal setting with the individuals. So again, aggressive coaching is important and will make a big difference. So we have a 6-step coaching process. Like I said, you know, the coaches are working, these are outreach calls that coaches are making to your employees based on their biometric screenings, their personal health profile, their gaps in care, and then of course there is ongoing continued support with the coaches. And these coaches are all trained on the intrinsic coaching methodology, so that they are working with the individuals, not to say, oh, you're overweight, you need to lose weight. It's not a stick really approach. It is more of an understanding. Let's talk about what might be your barriers to health. Let's talk about what your work-life balance is and why you can't get out and exercise, and let's come up with a program that makes sense for you as an individual. The coaches also have individual health programs that they work with our members on. We have very successful weight loss programs. It's called the First 5 Weight Loss Program, which is a 6-week coaching program just really geared toward individuals to try to get them jump-started. So it's not so scary. Losing 5 pounds is not as scary as having to lose 50. We also have a smoking cessation program that is also a 6-week intensive coaching program geared obviously to those folks that need to stop smoking. We do have 3 new programs that we will be introducing in early November. One is a pre-diabetes program, pre-hypertension, and the last is a stress management. And you know, all of these are relevant to everything that's happening in our life, whether it's lifestyle, health, or financial. All of these programs are offered in English and Spanish. So this is just an example of some of the results that from one of our customers that is happens to be a grocery store that had a really big problem with obesity, and they have had over 500 participants in the program and have lost combined over 1,400 pounds. So this is something that's been very, very, very successful to this client and many others. Let's talk about reporting here and the importance of data, because data targets interventions, but it also requires specific actions. I'm trying to Okay. This I always find is a very interesting screen because what it shows you here is self-reported data versus actual biometric data. So as we know, HRA data is often and is always actually self-reported. And this is just one example, just as it relates to prediabetes. So in most HRAs, the question is asked, do you think that do you have diabetes, or are you a pre-diabetic? And so people that just don't know typically answer no, and these are 3 different employers that we work with. As I said, we work with hospitals and many different kinds of employers. And once these biometric results came in, you can see the difference in the perception versus the reality. So it is really important to have good, strong data, because that data will require action. Our reporting, of course, we do aggregate summaries, are all HIPAA compliant, but we can give demographic information, we can give the HRA and biometric results, who's working with a coach, who has made health changes as a result of coaching. After we get the results, like I told you, we stratify the population so we can tell you what percentage falls in from the healthiest to the most chronic. And really, the important thing about this data is that you can then help design the programs and services along with the help of SHS for your own employees. And then if you are a hospital that's working with employers and you're getting this information, then you as a hospital will be going back to employer A and saying, geez, I see you have a very obese population. Let's get your population on a weight management program. And it can be SHS's, it can be yours. If they have high stress, you may want to bring out a stress management program, or do some on-site coaching education for depending on what kind of risks they have. But this is a really good opportunity for hospitals to engage and build those deep relationships with their employers. So just briefly, I want to talk to you about, if you are a self-funded group, what claims information can show us and how we can use that for coaching and increasing our interventions. And so this is just aggregate member information here, basically just showing you, who's engaged in your insurance, female demographics, all of that. The thing that I want to point out that's most important on this slide is the motivation rank. These people go through all kinds of algorithms through our claims analytics, and it will end up spitting out who's most motivated to make a change in their health. And that is really deemed on, I can say to you right now that a person who has had a heart attack, the day that they walk out of the hospital is the day that they're most motivated to make a change. So we get that information, and our coaches can then go and focus on those people that are most likely to make a healthcare change, which you're going to see a lot bigger results. This is an important slide because what I don't want you to think about, or what I don't want you to think, and a lot of people do, is that by not engaging your healthy population, that they're just going to stay healthy. So this happens to be one of our clients who here you can see that they went over to they got worse. They didn't stay engaged. They didn't target that healthy population. Again, this shows you that the pre-zones, and really the focus on those pre-zone members and how well they did with getting better. And this is information, again, that claims data can show you. And lastly, I just want to show you the coaching impact on claims by using coaches. This happens to be a customer of ours that I'm showing you just 7 members with diseases that are high cost medical expenses, and you can see what they spent in 2015. Now, as you can see, that we are obviously still in 2016, so these are only forecasted savings for these individuals. But right now, today in October, there is a forecasted savings of over $500,000 for this employer. And again, all of these members are working with a coach on an ongoing basis. So lastly, let's talk about communications. It is so important the way that you communicate a wellness solution. You cannot over communicate with your employees, and the way that you communicate is so important, right? So you want to make sure that your employees know that they feel that they are your biggest asset, and the reason that you're bringing a wellness program to them is because you care about them and you want them to be healthier. And so not making it seem like, oh, our healthcare costs are so out of line, we need everyone, you know, who's overweight to lose weight, and, you know, we want to make them feel like you're doing this for their benefit. And so the way that our communications programs, I'm so sorry, are set up is really around making them feel better. And everything that we do in our communications is all private labeled. So even as you're on this webinar, you will see that we have an employee wellness for health systems on here as a PDF and a health tips flyer. Please download these. This health tips flyer, these are weekly health tips that are sent out to all of our customers that are private labeled for your hospital under your logo, and they are weekly health tips that are relevant to, you know, whatever is going on with the month, and can be distributed to your employees. They can be put in your break rooms, but just always communicating with your employees. Again, I told you that we start with a survey for your employees to understand their barriers to health, and there is once they've started participating, there will be another survey to see what they like. I can't emphasize enough how important it is that you have your leadership involved. Everyone talks about creating a culture of health. Well, it does begin at the top, and we have statistics that prove that there is over 4 times that you're over 4 times more likely to see marked improvement in your employees' health risks if you have your leadership involved, and 2.5 times more likely to report medical reductions in cost with your leadership involved. So we really work with you to get your leadership participating in the program, to working with not just the CEOs but also the supervisors and anyone that people look up to, and then creating people as their own coaches, and inspiring others, because that is really the biggest way that we see that people engage in the program as well, is that their colleagues are making changes and they're successful. And we use this a lot. These are just examples of how we're always communicating with you. You know, here's how you get on, you know, your portal, the things that are on your portal that are going to be important, why you should connect with your coach ongoing. We are always sending these out. There's an entire program guide that goes out, private labeled for your program based on your incentives. And as I talked about before, the member success stories are really important. We will personally go out and we interview these, your own employees, and we will publish these, and we can put them into a newsletter for you, and we can also put them, you know, you can post them in your break rooms and use them as an inspiration. I think that this slide really ties it together for you as a hospital, as an employer, and as a reseller. So here, this is actually one of our customers. This is Latasha. She works for Commercial Bank of Grayson, who is a customer of King's Daughters Medical Center. Through doing her HRA and her biometric screening, I mean, she knew that she was overweight, but she didn't know how overweight. She was having problems sleeping. One of the things that she realized by working with her coach is that she was really worried about her children and their nutrition and her being a good role model. So she started in the First 5 program. She's now lost 65 pounds. She started working with a coach on nutrition, so she's She's active with her coach. She's on her portal every day, tracking her steps. She's tracking her exercise. So for Latasha, she is a happier, healthier, more productive employee. For Commercial Bank of Grayson, they have a more productive and happier employee. Their health costs will go down because Latasha is no longer at risk for sleep apnea, for diabetes. And for King's Daughters, she didn't have a primary care physician. So they went, and now Latasha is a new patient for King's Daughters. So as you can see, the impact of this program has a multiple effect on all of you. And so lastly, just what's even as well as important is how easy this is to implement. You will have a dedicated account management team. Our portal takes less than 30 days to build and implement. It takes very limited resources on your end. We are doing all the build. We are doing the implementation. We require your input for your incentive planning and your scorecards. But outside of that, we're doing the work. We're providing you with weekly, monthly, quarterly reports. We're constantly looking at your participation and providing you with things that you can do to increase that participation. So a dedicated account management team that is working with you on an ongoing basis. So lastly, I just want to say, don't forget that we have this special offer for the people that are on here that are really looking to make an impact and really making a change with wellness for your employees. Take advantage of this special offer. We are offering spouses for free if you sign up by the end of December. And if anyone on the phone today is interested in a private demo of our engagement platform, I'm happy to do that, or would just like some another, discussion, some pricing information, please feel free to email me or contact me. Don't forget to download those documents on here, and I want to thank everyone for joining today, and have a happy and healthy afternoon. Thank you.